Mini Sprouts is an in-office dental milestone program, but it includes a lot more. We like to see pregnant mothers while they're expecting their baby so we can help them understand how to better take care of their dental needs or sleep changes that might be happening within their pregnancy. And then once the baby is born, that's when our milestone starts. We have an 8-step milestone check for kids that we will start from birth all the way up until they're 3 years old. Typically when kids are 3 years old, we will transition them in with our hygienist so they're able to start with their regular dental cleanings. But we feel it's really important for kids to get in before that so we can intercept things that might be happening early on. So our program here with Mini Sprouts is a one-of-a-kind program. A lot of people might think, why should they bring their babies in when they don't even have teeth to the dental office? But there are a lot of things happening. There's a lot of facial development and cranial development that's happening in those early years that we're able to track. So your palate, the roof of your mouth, is actually the floor of your sinus cavity. So if your palate is not growing properly, if it's growing too narrow or growing too tall, that can actually affect your whole nasal cavity and close it off so you're not able to breathe out of your nose very well. If you can't breathe out of your nose very well, you're going to mouth breathe. And if you mouth breathe, that can affect how your jaws grow. If your jaws grow small, you won't have enough room for not only your baby teeth, but then when your adult teeth start to come in, you certainly won't have room for those. So that's the goal of our program, to be able to catch those things early, give parents really good interceptive measures to do at home with their kids to help things grow the way they should grow and not wait until there's a problem and then we have to fix it. We have 6 steps to our Mini Sprouts program, 6 overarching categories that we like to talk about. The first one is breathing. The second is their oral posture, or how they hold their mouth when they're resting. The next one is dental development. We talk a lot about nutrition, how they're eating, what they're eating. We talk about their movement patterns, make sure they're hitting their milestones, and we want to know about their sleep and any irregular patterns with that. So we created Mini Sprouts because we noticed a void in our community where we really need to support kids a lot better. Typically, kids will not come to the dentist until they're about 3 years old. It can be scary for the kids. It can be intimidating for some providers if they're not sure what to do with kids. So we really like to focus on keeping the system very streamlined, so we are asking the same questions every time to make sure that your child is hitting their milestones here like they should be. You go see the pediatrician, they weigh your child, they measure your child, they make sure they're on their charts, but no one's really looking in their mouth. And that was the big driving force behind Mini Sprouts, is to make sure that someone is looking in their mouth and tracking all the things that matter to oral growth and development, because that is just as important as what the pediatrician is checking. If you have any questions about our Mini Sprouts program, feel free to give our office a call and we'll be happy to answer any questions or get you scheduled for an appointment.